Hello there, my name's Dr Andrew Pennington and I'm the practice principal and an integrative general practitioner at Sanctuary Lifestyle Clinic in Waitara in Sydney. I'd like to talk to you today a little bit about behavioural disorders in children, which encompasses a lot of different things, and they can also be things that are not necessarily diagnosed. But traditionally, I think the big ones that come up in our society, which we may have heard of, is attention deficit hyperactive disorder or attention deficit disorder, ADHD or ADD, oppositional defiance disorder or ODD. Then there's some other diagnoses which are a little bit less common, but I just want to focus on those two behavioural disorders today, but also to talk to parents who perhaps may not have had a diagnosis of those conditions, but may be struggling with their child's behaviour. One thing I've learnt over the years is that nutrition has a significant role to play in a developing child's brain, and each of us have inherited different biochemistries that predispose our brain to work in slightly different ways, and this is certainly true of children. I have learnt using some education and strategies through the techniques of Dr. Bill Walsh and Dr. Carl Pfeiffer in the United States, who pioneered looking at children's behavioural disorders. In particular, it looked at people who had been involved in criminal behaviour, and that was originally how Dr. Bill Walsh got involved in trying to understand what factors might be going on for these people. And he liaised with Dr. Carl Pfeiffer, a very eminent nutritional psychologist at the time, and they found that they could actually show quite similar chemistry in people's hair of those who had sociopathic tendencies. However, disappointingly, they found that it was quite difficult to treat these people. They must have, by the time they became adults and had offended on a number of occasions, they'd had ingrained patterns in their brain that were quite hard to change. So they turned their attention to children, and they certainly found that rarely you would find some children who had significant personality, aggression, violent behavioural traits, and they would get themselves into trouble. And this was independent of parenting style. And they come to understand that these children had significantly abnormal chemistry compared to others who didn't have these traits. And they found that they were very successful in being able to treat these children. In 2004, Dr. Walsh published a study on violent and aggressive children, around 207 subjects, and they showed that with good nutritional treatment, particularly nutritional supplements, they were actually able to reduce violent behaviour by 90%. That is to say, 90% of these children had either eliminated or significantly improved their violent behaviour. And this is pretty significant. Unfortunately, it wasn't a randomised trial, and different nutritional strategies were used each time, so there were some criticisms of the trial. Last year, out of Griffith University in Australia, there was a trial published looking at violent and aggressive male children between the ages of 4 and 14. A much smaller trial, only around 30 to 35 children, but this time round they used exactly the same nutritional supplement treatment. And again, they found some excellent results that a significant proportion of these children improved their behaviour substantially. And I find this very, very exciting because we know that people can improve their behaviour when we improve their nutrition. And there is also some other evidence for ADHD in particular. There's a small randomised trial that was done in New Zealand under the direction of Professor Julia Rutledge using micronutrient therapy in adults, and it found that it was also able to significantly improve ADHD symptoms. We also know by association there's been some trials published about diet quality and ADHD, and there is reasonably good association evidence, albeit not proven causally, that diets rich in vegetables, fruits, whole grains, omega-3 fatty acids are less likely to be associated with ADHD, and diets high in refined sugars, junk foods, and omega-6 are more likely to be associated with ADHD. I've now used some of these techniques to look at children's behaviour, even who haven't had diagnosis of ADHD, and it's so significant how easy it is actually in many cases to improve their behaviour once you understand their chemistry and you can treat them using appropriate dietary strategies, and obviously improving their vegetable content, their fruit and vegetable content, often their omega-3 content, using supplements or using flaxseed oil or fish oil can be a very helpful strategy in assisting these children. And it's an area of strong interest for me, and I love seeing children here who might be struggling, and the parents might come in and tell me that their teachers are struggling to deal with them in class. They're being disruptive, or they might be aggressive or violent to other children, or they're just inattentive and daydreaming in class. And these children benefit very greatly from improved nutrition. Of course, there are other strategies that are also very important, and that's using trained psychologists, occupational therapists, speech pathologists, paediatricians, those who have expertise in various areas of behaviour that can also assist. But we have found that unless you can actually help that person's brain chemistry work better through better nutrition, you'll find it more difficult to work with counselling-based strategies with these children as well. But I just hope that stimulates your interest, that if that seems to be relevant to you, or maybe a family member is struggling with children, or you know a friend, I'd love to see these children and really try and prevent them from getting into a situation where they struggle in class and can't achieve their full potential, because I really believe that with good nutrition, with good brain chemistry, these children can be the best that they can be. If this resonates with you and you'd like to consider seeing me at Sanctuary Lifestyle Clinic, please just click on the descriptor below on this video and you'll see the website, Sanctuary Lifestyle Clinic, which is sanctuaryclinic.com.au, or you can go to our Facebook page and like it and then book now, and periodically I put up links and small blog posts on that Facebook page. You can also call 1300 723 070 for an appointment.